In this section, we will review drugs based on their actions, indications, and precautions. Drugs are listed with the generic names followed by the brand names in brackets. Analgesics are used to relieve pain without causing loss of consciousness. Anesthetics may be local or general. Non-narcotic analgesics are aspirin or acetaminophen or Tylenol, which are used as antipyretic drugs to reduce fever or as a pain relief. Antipyretic, pain relief, ibuprofen such as Advil or Motrin is a non-steroidal anti-inflammatory drug for osteoarthritis and dysmenorrhea or menstrual pain. A narcotic analgesics, these are derived from opium. They can induce sleep, depress the nervous system, or relieve pain. Adverse reactions include nausea and vomiting. Excessive doses may result in death and/or coma. They are capable of causing physiologic dependency if used regularly. Examples are morphine sulfate or morphine, or meperidine HCl or Demerol. Anesthetics are drugs that produce a partial or complete loss of sensation with or without the loss of consciousness. They act on the central nervous system, or CNS, to produce a loss of sensation. Local anesthetics are lidocaine, such as lidocaine or xylocaine, procaine HCl, such as Novocaine. Local anesthesia are used to eliminate the sensation of pain in a specific area before beginning a painful procedure or in the treatment of ventricular arrhythmias. They are available in a variety of strengths, with and without epinephrine. They block nerve conduction from a specific area of the body to the central nervous system. An example of a general anesthetic is thiopenyl sodium, or pentothal. It is a central nervous system depressant and induces relaxation of muscles, but can lead to a loss of consciousness. Antagonists are used to counteract the effects of certain drugs. For example, to counter the effects of Valium or overdoses of opioids. Example is naloxone or Narcan, which is used to counteract the effects of opioids, such as morphine, and prevents or reverses respiratory depression, sedation, and hypotension. Anti-anxiety agents, or mild tranquilizers, are drugs that are used in the treatment of anxiety to calm the patient without causing central nervous system depression, or to elevate the patient's mood without stimulating the central nervous system. Examples include diazepam or Valium, which is the most widely prescribed drug for the treatment of anxiety. It may also be used to alleviate muscle spasms and as a preoperative drug for various procedures in the radiology department. It may cause physiological dependency with prolonged use. Antiarrhythmics are drugs used to treat arrhythmias. Abnormal rhythms may occur in the atria, the upper chambers of the heart, and in the ventricles, the lower chambers of the heart. The type of arrhythmia drug used depends on the type of arrhythmia that needs to be treated. Quinidine or cardiaquin is commonly used to treat atrial arrhythmias. Beryllium or bretalol is commonly used for ventricular arrhythmias. Antibiotics or antimicrobials are drugs used to destroy or inhibit the growth of microorganisms. Allergic reactions to antibiotics are common and range from mild to severe or even fatal. Broad-spectrum antibiotics are antibiotics that are effective against large numbers of microorganisms. For example, oxytetracycline or terramycin and penicillin or pentids. Narrow-spectrum antibiotics are antibiotics that are ineffective against only a few microorganisms. For example, erythromycin or erythrocin. Anticholinergics or antispasmodics are drugs used to reduce smooth muscle tone, motility of the GI tract, and secretions from the respiratory tract and the secretory glands. These drugs can cause the patient to perspire less and can cause a dry mouth. High doses of these medications can cause serious side effects, including delirium, rapid heartbeat, and coma. Some are derived from plants and some are synthetically produced. An example is atropine or atropine, which is a drug derived from the plant Atropia belladonna. Anticoagulants are drugs that inhibit the clotting time of the blood or increase coagulation time. These can be given to patients undergoing interventional procedures. Patients must be continuously monitored for massive hemorrhages, which is a side effect of overdose. Examples include enoxaparin or Lovenox, which is administered intravenously, and warfarin or Coumadin or heparin. Heparin is not effective when administered orally. It is not absorbed from the GI tract, and it should not be given intramuscularly because it may cause a hematoma. Anticonvulsive drugs are used to prevent or control seizures. They do not treat the causes of seizures. Examples are clonazepam or Klonopin, an oral anticonvulsive used to control petit mal seizures, and phenytoin or dilantin, an oral or parenteral drug used to control grand mal seizures. Antidepressants are drugs used in the treatment of depression. They must be administered for several weeks to achieve their maximum therapeutic effect. These drugs may cause dependency over a long period of time. Examples are amitriptyline hypochloride or Elavil. Anti-diabetic agents are used to treat diabetes mellitus, which is an insulin deficiency and insulin resistance condition. For example, metformin or glucophage or insulin. Metformin should be discontinued for a period of 48 hours after the injection of any iodine-based contrast agent. Antiemetics are used to prevent and treat nausea and vomiting. An example is dimenhydrinate or Dramamine, which is available in oral or perennial forms. Antifungal agents are used to destroy or suppress the growth or multiplication of fungal infections. Fungal infections are more likely to occur in patients who are immunocompromised and can be localized or affect the entire body. For example, fluconazole or Diflucan. Antihistamines are drugs used to primarily treat chronic or acute allergic disorders. They are also used to treat viral conditions such as upper respiratory tract infections and the common cold. Examples are diphenhydramine HCl or Benadryl. It is the most frequently used antihistamine. It has a sedative and anticholinergic or drying side effects and may be used as a pre-medication for patients expected to have an allergic reaction. It can be given intramuscularly. Another example is promethazine hydrochloride or Phenregan. This is used for pre-operative patients. Antihyperlipidemic agents are used to prevent the development of atherosclerosis. Hyperlipidemia is associated with atherosclerosis. An example is atorvastatin or Lipitor or simvastatin or Zocor. Antihypertensive medication is used to treat moderate to severe hypertension. High blood pressure can be caused by many factors. Therefore, there are a variety of drugs on the market that can be used to treat the condition. Examples are atenolol or Tenamart and metoprolol or Lopressor, which are administered orally, and dioxide or Hyperstat which is given intravenously. Antiplatelets are used to inhibit platelet clumping in order to prevent myocardial infarctions, or MIs, or the blockage of a coronary artery. They can also be used to prevent a stroke or other transischemic attacks. For example, an aspirin. Antipsychotic drugs are used as major tranquilizers in order to treat psychiatric disorders such as schizophrenia. For example, chlorpromazine or thorazine, which can be oral or parenteral. Side effects include sedation or, over a long period of time, physiological dependence. Anti-ulcer agents are effective drugs for gastric and duodenal ulcers or other disorders that cause the excessive or prolonged secretion of hydrochloric acid in the stomach. Examples are ranitidine hypochloride, or Xantex, or sodium bicarbonate, or baking soda. Metoclopramine, or Reglan, increases peristalsis and accelerates gastric emptying without increasing gastric secretions. Sucralfate, or Carafate, covers or coats the ulcer and protects it from the actions of stomach acids. Antivirals are a type of medication that is used to destroy or suppress the growth or multiplication of viruses. They can be used to treat herpes simplex, chickenpox, shingles, the flu or influenza as forms of viruses. For example, oseltamivir phosphate or Tamiflu. Bronchodilators are used to treat asthma and chronic obstructive pulmonary diseases. These drugs work to dilate bronchioles by relaxing spasms in the bronchial walls. Epinephrine, or adrenaline, administered intravenously, can be directly injected into the heart in emergencies. It can also be used to treat angioedema, shock, or respiratory distress, or severe allergies. Cholinesterase inhibitors are used to increase the levels of acetylcholine, which is a major neurotransmitter in the central nervous system, or CNS. These are sometimes used in the treatment of Alzheimer's disease. They can induce muscle relaxation under general anesthesia. For example, donepezil or ARRT. Coagulants are drugs used to control hemorrhages or speed up coagulation. Most of these contain vitamin K, a fat soluble needed for normal blood coagulation. Phytonadione or vitamin K, Methton, can be given oral or parenterally. Corticosteroids are used to control symptoms of chronic, long-term, and acute short-term inflammations. Examples are epinephrine or adrenaline, or hydrocortisones, or Solocortif or hydrocortisone. Meflopristone, such as Depo-Medrol, is a corticosteroid that acts as an anti-inflammatory agent and can be injected directly into the joint or bursa. Hydrocortisones are for systemic use and can also be an antibacterial. They suppress the inflammatory response to irritants, but may also delay healing and inhibit the body's response to infections. Diuretics are drugs that increase the amount of urine excreted by the kidneys, thus removing sodium and water from the body. Diuretics can be used in conjunction with antihypertensive drugs for the treatment of high blood pressure. For example, furosemide or Lasix, it is often used in the treatment of edema, which is associated with congestive heart failure, or CHF. Emetics are drugs used to produce emesis, or vomiting. Examples are activated charcoal, which is a whole body bowel irrigation, apomorphine or epoxine is a fast active IV emetic, or syrup of ipecac or ipecac is an older drug that is not normally used today. Hormones are drugs that act as stimulants in order to increase the functional activity of a particular gland or organ. For example, sex hormones stimulate the development and maintenance of sexual characteristics. Examples are insulin or Premarin or estrogen, the female sex hormone. Estrogen is sometimes used in the male patients to treat neoplastic disorders involving the male sex organs, and the reverse is also true. Laxative or cathartics are used to promote the elimination of feces from the large bowels. For example, Bicyclidil or Dulcolax is used to increase motility of the GI tract. It tends to produce loose, watery stools. For example, Bicyclidil or Dulcolax is used to increase motility of the GI tract. It tends to produce loose, watery stools. Mood stabilizing drugs are used to treat mood swings in patients with manic depressive or bipolar disorders. For example, lithium. Non-steroidal anti-inflammatory drugs, or NSAIDs, are drugs used to treat inflammation. NSAIDs' effects take 1 to 2 weeks to be evident. Examples are ibuprofen or Motrin, Clinaril or Sudelinidac, and Celebrex or celecoxib. These are all oral NSAIDs. Sedatives or hypnotics are used to depress the activity of the central nervous system. The effects may vary from mild sedation to the deep loss of consciousness. Extended use of sedatives lead to addiction. Examples are phenobarbital or Nembutal or secobarbital or Seconal, chloral hydrate syrup or chloral hydrate is an effective sedative for children. Stimulants are drugs that increase the central nervous system activity. CNS stimulants increase activity of the brain and the spinal cord. For example, dextroamphetamine or dexedrine is used to treat obesity. Doxapram hydrochloride or Dopram is a respiratory stimulant. Dobutamine hydrochloride or Dopatrex and dopamine hydrochloride, intropine, stimulate the myocardial of the heart and are administered parentally to treat conditions such as hypotension and shock. Methylphenidate or Ritalin and dextroamphetamine and amphetamine or Adderall are used to treat hyperactivity in children. Thrombolytics are drugs used to dissolve clots. Adelplase or Activase is a recombination form of human TPA. It is used to treat a stroke caused by a blood clot or other obstructions in blood vessels. Vasodilators are drugs used to cause vessel dilation, especially in the treatment of atherosclerotic disease, or ASD. Examples are nitroglycerin, such as Nitrogard, which is used as a coronary vasodilator for angina. Headache is one side effect of this medication, and sodium nitroprussate or Nitropress, which is a peripheral vasodilator for the treatment of hypertensive crisis or heart failure. Vasoconstrictors are used to constrict blood vessels, thereby raising blood pressure. They can be used to treat shock. Examples are norepinephrine or Levophed. A major side effect of norepinephrine is infiltration, which can cause tissue necrosis. To be safe, it can only be administered through an IV. Matraminol or Aramine is another vasoconstrictor. It can be used for subcutaneous and IM or intramuscular injections. Drug resources can help identify medications, their doses, uses, and contraindications. These sources include the package insert, which lists the drug's generic name, trade name, chemical composition, chemical strength, usual dose, indications, contraindications, and reported side effects. Safety data sheets, or SDS, includes information such as the properties of each chemical, the physical, health, and environmental health hazards, protective measures, and safety precautions for handling, storing, and transporting the chemical. OSHA requires that all healthcare facilities have a safety data sheet in the workplace for each hazardous chemical that is present. An SDS, or safety data sheet, provides detailed information about the specific chemical product. The Hazard Communication Standard, or HCS, requires chemical manufacturers, distributors, or importers to provide safety data sheets. These were formerly known as Material Safety Data Sheets, or MSDS, to communicate the hazards of hazardous chemical products.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free Radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.